Coming up on Mental Health Matters with Marty, our new series, House Calls with Dr. Allen. Stay tuned. What's up, everybody? Good evening and welcome to another show with Mental Health Matters with Marty. I am so excited that we are going to be starting this amazing new series. And again, my name is Martina Sellers, and I am your mental health hygienist coming to you live and in living color, baby, all the way from Southern California, where the sun is always shining. But we got a little rainfall today, and we needed it so bad. I'm out here in this IE, in this desert, but welcome. Let us know you are out there. Let us know you are listening. Let us know you are watching and where you are from. I am so excited that we're going to be doing this new series called House Calls with Dr. Allen. Yes. Hello, Nancy. Hello from Inglewood. Yes. Come on. Links is in the house. So glad that we are here. And with that, so today's show is sponsored by is sponsored by the Gardena Women's Center also with Marcel Consulting and Mental Health Services. But we're also in collaboration with so many great organizations as well. So without any further ado, I want to bring on to the show. We're going to be doing this every other Wednesday, every 2 weeks on Wednesdays. And I want to bring on my co-host with House Calls, Miss none other than Dr. Gwen Allen.
Hey, Marty. Thank you for having me on again. I'm just happy to be here and happy
to have
collaborations with the organizations that I happen to be affiliated with.
Yeah.
Today's show. Go ahead, Marty. I'm sorry.
No, I'm saying, I'm excited. Listen, we're doing this new show, House Calls. And I love it because when we were on a few weeks ago, Dr. Allen, we got so many hits, and this was so great, and I think we have to, and I love this whole thought that you had about bringing the awareness to our communities with that as well. But let's talk about who we're in collaboration with, and we're going to dive right into some of the things. So who are we in collaboration with tonight?
We're in collaboration with Delta Sigma Theta Sorority Incorporated, Inglewood Alumni Chapter.
Okay.
Our president is Madam Cheryl Gully. She's also live streaming with us. Unfortunately, we could not get her on, but she's saying hi to you.
Hello.
On live stream. Hello, President Gully. How are you? We're also in collaboration with the Inglewood Pacific chapter of the Links Incorporated.
Yes.
Our facet chair is actually Lula Morehouse, who's actually streaming live with us tonight.
Miss Morehouse, good to see you. Sorry we had some technical things, but we appreciate the links and we're so grateful for the deltas with that. How long have you been a part of these organizations, Dr. Allen?
Over I can't even tell, like 15 plus years and everything after college and things of that nature. It's a good way to get information out to the community,
right,
to high numbers of people, to disseminate good information about medical, about social things, about mental health. And so that's why we wanted to do this and put this information out to the community. And through these organizations, we can reach hundreds of people.
Yes. Listen, what do we want you to do? Everyone here, invite people, type people's names in the link, get people on the phone. We have too much valuable information and we have so many amazing doctors on here that we're going to have this conversation. We want to blow these numbers up. We want people to be informed and aware. So Dr. Allen and I, we want to make this clear. And with this show is intended for educational purposes only. Go ahead, Dr. Allen, with the rest of this that we want to share with them.
This is for educational purposes only. We put this show together tonight to just inform our community.
Yes.
We want to dispel most of the myths or all of the myths that are out there.
Yes.
And we want African-American people and people of color to make informed decisions about taking the vaccines, not taking the vaccines, and ask questions to us if you would like to. My major concern is that I want everyone to have an informed decision.
Yes.
We do not support any vaccines. We're not paid sponsors by Merck or any of Johnson & Johnson, any of those people who are given the vaccines. We just took this opportunity to put information out there so everyone can make informed decisions about this.
That's right. That's so good. And thank you. I got my second vaccination today. So excited. So great. And my household is now fully vaccinated. Dr. Allen, you got some shout outs. Proud of you to have Dr. Allen as our chapter member. Physical and mental health is so very important. Yes.
Most definitely. Again, that is our president, Cheryl Gully, who happened to be online. Unfortunately, we couldn't get you on, Cheryl, but we were going to represent Delta Sigma Theta in the House, as well as the links. And also one of our, actually two of our doctors that are on our panel today are actually members of Delta Sigma Theta. And also we have Alpha Kappa Alpha Incorporated sorority. Oops, sorry about that, Jamie. Dr. Horn will be from Alpha Kappa Alpha. So we have a good representation of all the sororities here tonight. And
that's right.
Also board certified physicians and
that's right.
So you have good information from reputable sources in the community, and they're also coming live from you from Midwest in the South.
Yes, this is amazing because too often we don't have, and I love when you thought of this show, too often we don't have informed and board certified people that we can ask these questions to. So let's jump right in. Dr. Allen, let's listen. What exactly is COVID? We've heard everything about it, because we've been in this quarantine for a year now. Right. What exactly is COVID-19?
COVID-19. And what we want to bring to you tonight, COVID-19, it basically is since coronavirus. Mm-hmm. All of us know that this was not a virus that just happened to pop up out of the day to say, okay, now we have coronavirus.
Right.
The reason why there's a 19 at the end of COVID, that's because the virus was discovered in 2019. So therefore, there's multiple strains of coronavirus, and corona has been around for a long period of time. It is an airborne virus, and that's why we tell people to kind of keep 6 feet apart.
Right.
At this time period, if someone coughs and sneezes on you, the document has shown that at least 6 feet apart, you can stop the droplets from getting into your airways. So that's not a magical number about 6 feet. So it's very important for you to actually stay 6 feet apart so you will not contract the virus.
Yes.
So corona is actually... Sorry, Giselle. Coronavirus is actually a virus that is actually an airborne virus, and so you have to make sure that you kind of protect yourself away from it. It is not something that the government made up. It is something that is actually out there. If you look on the back of your Purex wipes or anything of that nature, that was some form of corona.
Right.
Like anything with H1N1, which is your Haemophilus influenza virus, these things have been out there. Now they're out there spreading in a multitude, and many people are catching it. So we don't know how it came about. Some people believe that it was a government type thing. Some people believe that it's a conspiracy.
Right.
I'm here tonight to tell you that it exists. We have been, yourself as well as myself have been exposed to coronavirus.
Yes.
We have, been ill with it, and then we also recovered, but we have also been vaccinated. So you don't see a horn flying out of my ears and my nose or anything of that nature.
Right.
I took the vaccine to make sure I am protected.
That's right.
Tonight we will talk about the pros and cons of taking the vaccine.
Yes.
And we will talk about what it is, what type of virus it is, and how to stay safe in this era.
Yeah, that's amazing because, we don't like, and we have such a high, and you and I shared this last time, distrust about the medical system and even mental health services. And that's why I'm so glad that we have these amazing African-American doctors on here. And I'm also excited because it's International Women's Month. And all our panelists tonight are African-American board certified. Touch your neighbor, say board certified. They got that real documents to prove it, and the student loans as well. So they did the time and the crime to be board certified, and they're giving us great information. Listen, I don't see enough names going in the text and memo section, y'all. Get your neighbors, get everybody, get your dog, your cat, your goldfish, everybody up in here tonight, because we need this information. So many of us have been catching that, and it's disproportionate in our African-American communities. Why is that, and what can we do in addition to staying vaccinated or getting the vaccine?
I'm sorry. I had lost. You know me, Marty. I'm looking at the text.
Right.
Marty got me off guard.
You're all right. So because it's disproportionate in our neighbor
Right.
in the African American community, why is that? Why is it disproportionate rates for us?
Disproportionate rates for one or two things is that we do not have enough centers and spaces to give out the vaccines. So the government basically put these vaccines in
Mm-hmm.
your community. So if you look around you, how many places in Inglewood, Carson, or those areas, how many Walgreens do you see? How
Right.
many CVSs do you see?
Right.
Those are the things that you got to look for. Then also you have to say, okay, how many federally qualified clinics do you have in
Uh-huh.
those particular areas? If they push the vaccines out to the Walgreens and the CVS, there's not many in there. We have the mom and pop and the small
Right. That's
pharmacies
good.
that we see on the corner, so we don't get an opportunity to get those mass vaccines out there. And also in African American communities, we do not have the federally qualified clinics that some of our doctors work with that have the vaccine.
Right.
So then we have the churches are there, but the churches are the last people to get the vaccine. So um, we have to talk about the fact that we are just lack of exposure. We do not
Mm-hmm.
have the resource. We do not have the places. And then
Mm-hmm.
also they feel sometimes that we're not going to take it. So they
Yes.
put the resources in other areas and not on our own. So it is up to organizations like Delta Sigma Theta, Kappa
Yes.
Psi, Alpha Kappa Alpha, and all the Greek organization and any organization that support Black communities or brown and belt health to say that, hey, we need the vaccines in our area. We need to do something about it. We
Yes.
just need to get together and
There
say,
we go.
we need these vaccines in order to vaccinate our congregation. As a
Yes.
people, we do not have a voice in where these vaccines are going. So the disproportionate numbers of vaccines are going in other places and
Yes.
coming into the local communities where they can help people. Also, in our community, we
Mm-hmm.
have a disproportionate number of hypertension,
That's
diabetes,
it.
and all those things. And so that contributes to the comorbidities
Yes.
associated with the virus. And
Yes.
therefore, we should be the ones who are first to get it.
Yes.
However, because of the resources, because of the finances, it does not trickle down to the underserved communities.
Yes.
But
And I
they're
definitely
trying to get
uh-huh.
they're trying to get the government is also trying to get areas or try to get churches and things of that nature to get the vaccines. They're trying to get smaller
Yes.
clinics in order to vaccinate our
Yes.
people. So that should be our push.
Love it, love it, love it. Love this. Dr. Victor Beecham, hey, I'm here. Good, good. Yes, great, great. Says, I'm still struggling to get the shot. Be praying, but still not sure. Great, Victor. See, I'm glad you're on here. That's definitely one we want to talk to you about. Victor, we have some amazing board certified doctors here. They're not clinicians, they're doctors here to help us with that. And we want to help you make an informed decision. We want to dispel every myth. So we're going to talk about that. So Dr. Allen, can you definitely invite our guest on? But before I say, Paula says, I want to know, is the Johnson & Johnson vaccination not as effective as the other two? Can you choose if you can get one of these two over the one? You know what, Paula, you're right on track, and that's part of our question. You're still in my thunder, Paula. You're still in our thunder. We're going to bring on these doctors, and those are some of the questions we're going to be doing. Get people out there. Those of you who are skeptics, get some more names out there so we can do it. Dr. Allen, introduce our guest for tonight.
Oh, so I have three wonderful African American physicians. We're going to bring them back. The first one I would like to introduce, again, we're going to bring back to the forum, will be Dr. Jamie Horn. Dr. Jamie Horn comes from us from Chicago. Can you give a shout out to Dr. Jamie Horn?
Dr. Horn, welcome.
Hi.
Welcome.
Hi, thank you for having me again. I'm happy to be here.
Yes. Hey, how's Chicago treating you out there?
You know what? It's in the 60s, so I'm happy. I know it's a little cold for you guys in Cali, but I'm happy.
No, we've been in the 50s, so you all right.
All right, cool.
We're catching up with you, Jamie, over here.
Right.
We'll get back
When y'all get the snow, let me know.
Right.
I can see the snow. I'm right at the foot of the mountain, so I can see the snow-capped mountains. So yes.
Okay.
All right.
The next person that we'll have up, Gisele McKinney Hawkins. Gisele is also there.
Hello.
Herself again.
I'm originally from Chicago, but I'm in Lake Charles, Louisiana right now. So
Come on, Lake Charles.
It's like in the 70s here, so it's good.
Y'all got good weather. Well, welcome back. You two have been absolutely amazing, and thank you again for coming back. And Dr. Allen, our third guest for tonight.
Our third guest for tonight is also a member of Delta Sigma Theta Sorority Incorporated and is actually a board-certified pediatrician who will speak to our guests on vaccinating our teenagers, our
That's
kids,
good.
things of that nature. I'd like to bring on Dr. Shelly Dixon.
Yes. Dr. Dixon, welcome.
Thank you. Good to be here.
Well, we want to first welcome you to the Mental Health Matters with Marty show in collaboration and joint with, what are we calling this? House Calls with Dr. Allen. You know, first, y'all, this is absolutely amazing to see these 4 amazing Black female physicians, and we are not out there doing all these other things. Listen, love all these sister doctors. That's right. We are blessed because of all of you. That's right, Camille. Come on, y'all. Y'all give applause up. Let me see them hearts and those thumbs up for these doctors. They are beautiful. They are doing the work. You know, a lot of times we don't highlight enough of our own community doing the work, and you guys are doing it. So I salute you as physicians who are frontline, who've been dealing with this over a year, because I know you guys heard things before before we went on lockdown, and for International Women's Month as well. So we salute you and honor all 4 of you for your amazing work with that. Dr. Allen, let's jump into some of these questions. I know that, and Dr. Allen, you're going to sign with that. Dr. McKinney, we're talking about the comparison because people want to know the difference between all of these vaccinations. Is there a difference? Does it matter which one you get? What do you say with that one?
Okay, so all of the vaccines are effective. You have to determine if you're in an area that's more rural and you don't have the appropriate freezers conditions to transport and store the 2 vaccines you need, which would be about 21 days apart, then you can't get the Moderna or the Pfizer vaccine. So transportation and storage are an issue. So that leaves you with the Moderna vaccine, the Johnson & Johnson vaccine, which requires no storage, and it's 1 injection. You don't have to come back for the second one. So yes, they're both effective. The people get caught up into the numbers. The number of efficacy for the Pfizer vaccine is 95%, and the Moderna vaccine is 94%.
Right.
But then you get the Johnson & Johnson, and it's about 76% effective. However, all 3 vaccines will prevent death, hospitalization, and intubation. We already know that when a person gets intubated with the COVID vaccine, their longevity on the ventilator decreases their survival rate, and they end up either dying or severely incapacitated. So what we're focusing on is not just the percentage of efficacy, but what the virus can prevent, the vaccine can prevent. We already know that the symptoms are coughing, shortness of breath, sometimes rashes, congestion, sore throat. You can feel like you have the flu, but I strongly encourage people to go get tested. And when you hear people in the media talking about the Black population is not getting it, so is the white population. So we harp on the negative in the media, but we are getting it. You see people like Dr. Allen, Dr. Horn, and Dr. Shelly and I, we're getting it. But only 12% of the entire state of Texas has even gotten it, and their governor has opened the state up to the point the attorney general is trying to sue Austin for not wanting to do it. I think it's Austin, but you can't sue a mayor for not decreasing the mask mandate when we already know that saves lives. So you have to look at the whole picture. All 3 vaccines saves lives. All 3 vaccines prevent hospitalization and intubation. So when you put it on that contingency, yes, the Moderna is as good as the Johnson & Johnson and the Pfizer vaccine. All of them prevent. And that's what we're here for.
Yes. One of the things that I would like to add is that most people come to ask you, can I take a Johnson & Johnson vaccine or can I switch over? The answer to your question is no. Once you start off with Pfizer, you continue with Pfizer. Once you start off with Moderna, you continue with Moderna.
Yes.
When you do Johnson & Johnson with the one shot, that's all you do. That
one and
one
done.
shot vaccine that's done. Now, the other question that we want to talk about, let's talk about the Black community.
Yes.
Dr. Horn, we both would sit there, we talked about it and said, my God, I am not going to take this vaccine. We thought about that. We were just as hesitant as the community because why? What did we say? We do not want to grow horns, get scaled, but I did want to get myself I wanted to be a Storm or maybe Wolverine. I don't know. But I said to myself that, those are kind of things I want. But we were hesitant people. So you don't have to sit down like, oh, there's a group of Black women. Group of Black
You're
women
popular.
Who
now you don't have to go deliver a baby, do you?
Right, I'm on call. I have to stay with them.
We keep it real here. Listen.
They're at home in Chicago sleeping. I still got on my scrub and talk about hold on. But anyway,
hold that baby.
I gotta talk for 45 minutes. 5:28, but we're not gonna talk about that. But look, Jamie, Dr. Horn, let's talk about the fact that there are myths
That's good.
that that people have concerns about this vaccine and then they do not want to take it. You and I both had our days about should I take the vaccine? So tell us about what your concern myths that you were thinking about when you took
good.
Part of my hesitancy though was who was president at the time the vaccine came about. And I didn't feel comfortable taking anything Trump said, recommended, had his fingers in. But when Dr. Fauci recommended it, I looked into it and I became more comfortable with it. I think another thing that scared me, I started seeing a lot of my pregnant patients with COVID. I had a young girl who came in just with the sniffles, wasn't feeling that bad. Her COVID test was positive. We delivered her baby. But then she ended up getting transferred. She got pretty sick. And that night, I realized you can go from feeling okay one minute to the next minute, you're almost being intubated. And I think that was one of the things that kind of pushed me over the edge. I didn't want to bring this home to my family, my husband, my girl, spread it to other patients. So I felt comfortable taking it. And I try to tell other people, try to not help persuade, but just give patients or people the information. I had a long conversation with my trainer this morning, young Black guy who does not want to take it. His thing is conspiracies. He feels like they're doing experiments on Black folks and he wants to wait and see. He wants to wait a year to see what happens to all of us who've taken it. Like, will we still be alive and well to speak another day after getting the vaccine? But I also explained to him he's running the risk of getting COVID.
Yes.
So you need to decide. And he works with people. He's a trainer. So he works out with the public. So he needs to decide, does he want to take that risk? He has an older mother. He has a young daughter. It's not just about him, but he should also be thinking about his family.
Dr. Horn, I love that comment that you said because too often I love that we should be family driven maybe behind this as well. My 74-year-old mother lives with me and I'm responsible for her. And so I had to make sure that because I'm a therapist, now we're still doing Zoom, but it's still being out, making sure that I protect her. So we both are fully vaccinated and we both took two different ones. I had the Pfizer and she had Moderna and we both feel absolutely amazing. And thank you, Dr. Allen. I took all your advice on what to do before taking this shot and I feel absolutely amazing.
I need another thing that we need to talk about and, we could talk about Dr. Dixon. One of the things that we want to talk about is that what about these children? People come in, vaccine was, made too fast. Should I give it to my kids? Should my child be vaccinated before she goes to school? What are your thoughts on that as being a pediatrician?
Well, right now, the vaccine is only approved for children 16 and up. So right now they're doing the studies on children, I believe up to 12. So when the vaccine becomes available, they're already talking about how, they don't want their child to be vaccinated just because of like the other comment about how fast it was made and concern about the safety of the vaccine. So, I think a way to combat that is the education and just making sure it's safe for our kids. So like I said before, right now it's not approved for children younger than 16. So that's something that we have to continue to monitor and just see what the studies show.
Would you send your children back to school? Like, I don't have a child. So if
my kids are in school.
Your kids are in school?
Oh, yes, they have to go to school. I'm sorry. They have to go to school.
So that's some of the concerns that some of the people bring up. Do you send your kids to school?
Yeah, yes, I do. I do send them to school. They had all these things in place to keep our kids safe. They have plexiglass around their desk.
Mm-hmm.
They have to wear their mask when they come in. They get screened. They get, they ask us every day, does your child have a fever?
Right.
All the symptoms they run down. And I just pray that the whole, that everybody at the school, are mindful and being honest. And it's been working out fine. There have been no issues. And and I am going to be honest. I want the teachers to go back to the school because of, there's a lot of issues going on with behavior because mental health. There are a lot of kids are having mental health issues because of this, because they don't have an outlet. It's hard to sit in front of a computer all day doing e-learning. I mean, yes, they get breaks and, all of that, but I think it's really important for the kids to get back in school.
Dr. Dixon, can I ask you this? Should those of us who are sending our children back to school, is there any health things that we can do to help strengthen their immune system, such as making sure they take their vitamins and different things that you might recommend as a pediatrician that will help boost their immune system?
So, you mentioned it right away. You said vitamins. So vitamin D has already been proven to help boost the immune system and have just a better outcome. So yes, I always recommend to take vitamins, always recommend to increase fruits and vegetables. And just, eat healthy. That's very important. And that will help.
Yes. Excellent. Dr. Allen, your next question.
My next question, and that is my brother. My next question comes about the fact that let's dispel some of these myths.
Yes.
When we start off this conversation, we all Black or people of color, and especially with the Tuskegee Institute experiment, we have to talk about what's the difference now and what happened back then.
That's good.
Back then, and Dr. Hawkins will talk about this as well. Back then, they selected a group of Black men. They injected them with the virus, and then they waited for the outcome. They knew that the syphilis, they were looking for a treatment. At this particular point, there are checks and balances. There's a government that is in place. I know there's people who do not like the government, but there's a government in place, and there's also things that talk about research. You cannot do a lot of research without all of our checks and balances. Right now, you can't even inject a rabbit without putting your paperwork and things of that nature. You can't, for those of you guys who use the products of makeup, you can't even use a little guinea pig anymore.
Right.
So checks and balances in place, and they cannot select a group of people and say, I am going to inject you with coronavirus and see what happens in 20 years.
Right.
So you got to go back and look at your history, read your history. And I know a lot of people say they have not been good to African-American people throughout, but you have to educate, read, don't listen to me. Don't listen to Dr. Dixon and Horn or McKinney. What we have to do is also educate yourself. Don't talk to the man on the corner. I'm not going to take this shot because they injected us with syphilis a long time ago and now I got buds in the top of my head. So those are kind of things that we got to make sure that we have to say, those things don't exist. Dr. Dixon, what do you think? Giselle, what's your take on the Tuskegee Institute and their experiment, and how does it relate to us today in our midst, and why we have skepticism about taking the virus?
That's good.
I think that the sheer evilness of what they did with the Tuskegee experiment was that we already knew what penicillin would cure syphilis back then.
Right.
And you still injected these men with the spirochetes for syphilis. You refused them treatment. You watched the symptoms. And then when they sought treatment, the government went to get them out of facilities for treatment with a lie. So you tracked all the way from primary syphilis to tertiary syphilis, which is syphilis in your brain, your cerebral spinal fluid, to watch them suffer in silence when you had the antidote readily available. Now that people people have family members that were still alive that were during that time. However, there are checks and balances, like Dr. Allen said, that keep us from that. Is the government done some horrible things to both African Americans, Latinas, as well as Native Americans? Of course they have. Are they still? Of course they have. But we've made strides in healthcare to help alleviate some of the tragedy that we have, and it's not going on in this current environment. So,
can you address that comment right there? Not to cut you off, says I heard the myth that there's a chip in the vaccination.
Okay, so
the vaccine.
Then we all get ready to get chipped. I mean, what is the chip? I'm just not going there because we all about to be chipped. You ought to be more worried about the phone. The phone is the chip.
The phone is the chip. Yes.
So if you're worried about
Alexa is the chip.
Vaccine, then don't do
Most definitely Alexa.
Your phone is tracking everything you say, wherever you go, whatever you search. So be scared about something else. The chip in your vaccine is the least of things you have to worry about. I also want to address the young man, that Victor, that talked about he was trying to get the vaccine.
That's
Depending
good.
on your state, this week, several states have changed their levels. So in the state of Louisiana, you can get the vaccine from 18 and up if you have comorbid factors, or if you are around someone who is immunocompromised, if you have obesity, and we're the biggest state in the country, in the whole.
Right.
Except Jane, except over here, Gwen might. You're 25 BMI or up, and you're over the age of 18 in the state of Louisiana, you can get the vaccine. So I don't know where Victor's from. If he's from LA,
he's in California. He's in California. He's out here in Southern California.
They elevated their status, like they changed it. Monday it was something 55 and up, and by Wednesday it was up. Yesterday it was up to 18, and you could, as long as you had comorbid asthma, previous diagnosis of cancer, immunocompromised, working, education. So there's a whole list on your state Department of Health. Go on there and see how you can get the vaccine. Pharmacies are giving it. Some churches are giving it. Hospitals are giving it. The hospital is probably the hardest place to get it because everybody is going there. But you can walk into Target, CVS, Walmart,
especially down south.
Yes, and even some compound pharmacies are distributing it. So, chip, no, ma'am.
Let's readjust that issue of the chip. Let's talk about the physiologic aspect, or the the molecular aspects of the vaccine.
Okay.
You cannot put a chip in some water. Okay.
Well,
if anybody understands,
let's just say if we really did have technology for nanobites. Okay. The nanobites don't exist, but let's just say for theoretical purpose we have. Then the nanobite would chip you to do what? So what are we saying that this would do? We are already focusing on the mRNA that's available for the Pfizer and the Moderna vaccine. That's why it has to be frozen. It's a messenger RNA that penetrates the cell of your cellular structure to produce a protein that stimulates your body to produce antibodies for COVID-19. So that's technology that's been around for 10 years, but it's been used in this axis. So if you're really concerned as a Black population, a sister did this vaccine research. She's the one that developed the mRNA particle that went in to make this.
Right. Isn't that amazing?
Let's take it back a little bit because, mRNA, we got to talk to the people, how the people can understand. We're not injecting you if they're not injecting you with the virus like what they did with syphilis.
Right.
What they're doing is they're giving you something so your own body can make a protein to fight the virus.
That's good.
That's the difference between the Tuskegee Institute and what we're doing now. Another thing that we have to sit back and, Dr. Horn, you may address this. We get all these people, they're going to inject the virus in me and I'm going to get infertile. What's your take on that?
Oh, that's good.
Hello.
I have looked up a lot of stuff.
Okay. Are you there?
Okay. Yeah, I'm here. So I looked up a bunch of information.
Mm-hmm.
Can you hear me? Okay.
Yes, we can hear you.
I looked up a bunch of information on pregnancy, infertility, and vaccine. And I also spoke to the infertility physician that I work with. his recommendation is to get the vaccine. If it's your time to get the vaccine. And what I'm telling my pregnant women are to get the vaccine. Women that are not pregnant, trying to get pregnant, it doesn't interfere with your fertility. Women that are breastfeeding, get the vaccine, especially if you work in healthcare, a frontline, essential worker, because you definitely don't want to bring that home and bring that to your newborn baby. So right now, the vaccine and all 3 vaccines are recommended in pregnancy.
Good.
I want to address something. I just saw a question that comes about. They said that the African American community have skepticism about healthcare and the government in general. As Dr. Hawkins said, we have to be skeptical about everything. I have a friend who works in the industry of beverage, right? Do you know that we are obese because the fact of these big beverage companies send the high sugary drinks to the inner city? We're not saying that we're not going to drink strawberry soda or we're not going to take orange soda. What we are going to say that we're not going to take the vaccine, but yet and still I look at that picture and left behind. So we're going to say, I'm not going to do all these things. And Dr. Horn talked about the other day that people are going to drink a Red Bull. You don't even know what's in a Red Bull, let alone let's talk about what's in that marijuana plantation that you got on the street. Now we have marijuana that you can get a purple haze and all that kind of stuff. What's in that? You can go out. You don't know if they're giving you LSD or nothing. You got to pick your battles, people, and make sure the battle that you picking that's going to be the one that's going to create longevity. The virus here, when Marty will talk about this too, we have depression as healthcare providers. Every time I walk through that door, that hospital,
that's good.
I took an oath to help. But when I go in there, you are killing me because you have a virus that you refuse to wear your mask or take and then I have to sit there and take care of you, and the possibility that I may die. Do you know the anxiety that you bring about to us? And let's hear from Dr. Dixon, Dr. Horn, all the doctors that's on the panel to say,
love
how
that.
do you feel when people come into the hospital that they say, oh, I don't believe this. This is a government thing, and I'm not going to wear a mask, and I'm not going to do this thing, but I still have to take care of you coughing and hopping over me.
Ooh, come on.
And the problem, I have a colleague right now that has to have a lung replacement because her job was to take care of babies, deliver babies, and she got COVID and she has not recovered because society is saying, I'm not going to take the vaccine, I'm not going to wear my mask, but when you come into the hospital, you want us to do every single thing for you. How do you guys feel mentally?
Wow. Let me go back to a question that Asura put on the screen about the history of medicine and how the Black community distrusts healthcare.
Okay.
Yeah. If you want to go back to the father of gynecology, you can look in New York and how the horrible things that were done to slave women.
Yes.
To this point in history. You can go back and find horrible stories of medicine towards Black people throughout the millennia for decades and decades.
Yes.
And decades. There's even a poor presentation of maternal death in the Black population right now. More Black women are dying during labor and birth. However, to distrust all of medicine would be at our peril. So we have to be cognizant of what we're talking about. So if you're going to lump all of medicine and say you don't trust any of it, then we're going to die even worse. We don't participate in a lot of long-range studies. They know we don't participate, so they don't do one that affects our population. We have distrust about that. We don't educate ourselves, and we don't seek care early, so we have disease that is more advanced. We go to physicians that don't look like us, that don't understand the socioeconomic and how to approach us in a better way. And then we continue to take the abuse when we go to people that don't understand us. So it's a compounded layer, but we all have to understand that that participation relies upon us as well. So saying about the history that I'm not going to take it while we're dying at a disproportionate level is almost suicidal. You know that if a Black person gets on the bench and they have comorbid factors and they don't have the support, they're going to die. So you're going to die one way or the other. Pick which way you're going to do it.
Dr. McKinney, you're preaching.
Pick one.
I love that. If we don't take it, we are being, that's good. We are being suicidal. We're choosing to die. That's good. I got to use that. I'm going to let you know I'm stealing it. I said, I got it from a medical professional.
I'm freely getting it. You got to pick your poison.
That's right.
I agree with you. Picking that poison, and that poison, our poison at this point is that we want to live. You want to live. You everybody wants to live.
Yes.
I agree with that. And so, but again, let's address the fact, Dr. Horn, Dr. Dixon, how do you feel when parents come to you and say that I am not going to wear a mask, I don't believe it, and they're talking to you?
Yes.
How do you feel about that?
Oh,
good, Dr. Dixon.
Oh, okay. Well, I think that's disrespectful to me, and they're putting my other patients at risk. So they can't come into my office without wearing a mask.
Tell the truth.
Man.
Because when they do that, they're putting me at risk, they're putting my staff at risk, and they're putting my family at risk. So that's not an option in my office. You have to put on your mask.
That's good. Dr. Horn, what about yourself?
Sorry, there for a minute. Work together. The same policy. Dixon and I work together. Same policy. No mask, no service.
Right.
I think that's true of all of our offices.
Yes.
Yeah.
Let me ask you all this, because we don't hear about the PTSD that maybe you all are experiencing with this, especially with, you're seeing people die day in and day out. You did take the Hippocratic Oath, but I hear you, Dr. Allen. You said, I did not take it to die. I did not take it for you to disrespect me. That is so powerful. And not take my medical advice. If you're not going to take my medical advice, then get the hell out of my medical office and go over there and get your own QAnon office and your own QAnon and whatever on and get your own office, whatever non you want, and let them treat you. But coming in here, you got my rules, my play. Dr. McKinney, how are you feeling psychological? How do you even make it through the day? And what is your own self-care regimen?
I'm of the Jamie Horn school. I love self-love. I love me if don't nobody else love me. So I'm doing massages. I started bike riding again. I worked out. I started trying to change how I eat because I am the only woman at my campus, and I'm probably the oldest provider there. So when they have patients that don't want to wear a mask, and I was like, y'all not gonna set policy for me. I'm not. Y'all will walk around my dead body. So I have policies.
Sure enough,
younger ones won't do, but I have to look out for you. So if you can't induce policy that says that these people have to wear a mask, then I will. I'm telling you, if you're not going to wear a mask in the elevator, you can't get on this one. Oh, sweetie, sorry. Can you get the next one? Because you don't have no mask on. You're good.
I love that. Yes. Dr. Horn, you're not frozen now. Yes. How are you doing with that? What are you doing for your own self-care? And how are you doing with even the PTSD of what you're seeing?
You know what? I'm lucky. I have these women on speed dial. So I have called all of them. When I feel like I'm a break, I'm going to need a laugh. I was talking to Gisele today. I was like, you need to just make me laugh. Because right now, I am going through it. And it's good to have that support system. And also what I talked about the last time we were together, me and my Peloton bike, this is not a paid sponsorship, but we like this. That bike keeps me sane. So you got to find what works for you. And for me, my friends and family are doing it for me right now.
Love that. Dr. Dixon, same thing. How are you maintaining, and especially with so many children? Because we remember when the pandemic and the virus said, kids can't get it. That's a lie. Kids have gotten it.
That is true. They just, they tend to have less symptoms, but they can get it.
Right.
There's a small few that get severe disease, but it's nothing compared. I mean, I won't say it's nothing, but it's very few compared to adults. But yes, kids can get it.
Because I have a good friend of mine in Houston who they buried one of their students who got the virus and died, and we know that's a rare case, and the trauma that came behind it. And he is a principal, but he also is a cancer survivor, so he's not on campus, so he's trying to now console from a distance, and that's a lot that we haven't, and I believe y'all, we have not even seen the PTSD and the OCD and the trauma that's coming, and now post-COVID that's going to happen.
Well, actually, I do have children in my office where their older loved ones have died, and they are dealing with that.
Yes.
So, yeah, I'm already seeing that. So, we're doing the best we can, but I know that our behavioral health is overloaded with not only adults, but children as well, because they're affected in different ways.
Yeah, they are.
I think the percentage for children to get COVID is less, but than adults, because the thing is so high. But I mean, I'm shocked about the numbers that I've seen of babies.
Right.
Jamie had a newborn that had it, and we just found out one of our nurses,
Lord have mercy,
almost 1, and that baby has pericarditis and tested positive for the COVID virus. So she has antibodies, so they don't even know when she got it, but she's had cardiac problems from the virus.
Wow.
Normal and healthy.
Let's talk about this too. So a lot of things that people say that I got COVID and I'm protected and I'm not going to get it again. That's absolutely not true. So if you had COVID, that does not necessarily mean you have immunity against the virus. Just like the flu, there's multiple strands.
Right.
Again, let's talk about another myth. I got the shot. I got my 2 shots. So then therefore I can take off my mask and then I can go out and free the world. There are new CDC recommendations that basically said that, you can take off your mask. But in our community, my suggestion and my recommendation is, even if I'm vaccinated, so I still step into the hospital with not 1 mask, but 2. I will have my N95 and I have another mask on because again, there are variant strains that are out there. Just because I'm vaccinated against one strain, there's a possibility that another thing may come out. So you get your vaccination and you still have to use social distancing. You still have to use precautions. Let's not let our guards down. Let's continue doing what we always do. Is it being safe? I do recommend the vaccines. I'm not going to say don't, because again, what we see, the reason why we're putting this on tonight is because what we see is different from what you guys see out there.
Yes.
When it doesn't affect you immediately, we tend to stray away from it. We tend to say this will not happen to us. What I am telling you, that COVID is alive, COVID is real, and it is not slowing down.
Right.
Across that threshold, like we were talking about, again, how do we feel? I've called Dr. Horn, I have called Marty, because I even called Margaret Evans, who's not on the call tonight, because I had to go. It's one thing to go into a COVID room, but there's another thing to go into a COVID unit. Okay, so that means everybody around you have COVID, and then at the end of the day, you got to say, I got to go in there and treat that person. And you sitting there crying, you really in tears, or you're just basically saying, again, I took that oath, but I did not take it to die. Wow. If you saying that I don't like the vaccine, the government is trying to kill me. So what does that mean? That the government is trying to kill everybody? I know people think about, we're not sponsored by anybody, but the man named BG. BG is talking about population control. Getting rid of the poor, getting rid of this. So if that's the case, do you think that when you go smoke your weed, again, I'm on that, or even drink some of your drinks, that's not population control? Do you think that population control is not because you don't have good supermarkets in your neighborhood, that you don't have fresh food and vegetables, that they're not trying to kill you then? At least this is preventive.
That's good.
Try to protect yourself. If you're not going to do it for us, do it for your family.
That's good.
That you have to go out and see every day. So if you think about someone, you want to control your life and you want to control your environment, be safe. And if you don't want to take the vaccine, make sure that you wear your mask. Make sure you stay in your own silo. Build your own bubble. Don't come out and infect me. Stay where you are. Sorry.
Yeah, that's all right. Let's address that question that Paula had again. She says, now, does wearing a plastic shield along with the mask provide additional protection? Because, everyone's seeing these plastic shields. You can get them at Costco, in the 99-cent store, Dollar Tree, you name it. Are those effective when wearing it with the mask? Or do you just say, don't even wear the shield, do the double mask?
Well,
Gotcha.
people say there's no studies done on the shield,
Okay.
but it's another protective barrier. If we're using the plexiglass shields in the stores and the schools, then in theory, this face shield should give you an added protection. But don't wear a single layer mask like a bandana. Wear a surgical mask or a N95 mask or a double plied mask, not a single one. So if you're wearing a t-shirt material and you're wearing a bandana, it's not protecting anything. And even if you have a face shield, it's still offering less protection if you wore a appropriate styled mask. And you can get the requirements on cdc.gov, and you can find out which appropriate mask. They sell them at Target, Walmart, everywhere. They sell the appropriate mask that you might want. And if you have one that every sorority, fraternity, and links probably has a cloth mask, you can slide it N95 filter in there and change it every day if you want. So
that's good.
But someone else asked a question. I lost it when it was
There was one about immune. Someone says, I have an immune disease. How does the Pfizer, or they said, I'm just saying the vaccinations affect me. So do you recommend someone who has a compromised immune system? And I know this is, we want to continue to educate our people. Go ahead, Dr. McKinney, you were saying.
Well, I actually have an autoimmune disorder. I have rheumatoid arthritis. So the medication I take is a therapeutic agent. So what I was told with my rheumatologist, I had to stop taking my medicine for 2 weeks. Then I could get the vaccine. I had to stay off an additional 3 weeks to get the second vaccine. And then 2 weeks after that. So a total of 5 weeks, I was off my chemotherapeutic agent that makes me immunized. I had to stop taking it for 5 weeks, then get the start my treatment again to allow my body to be able to absorb the vaccine and have my immune system work appropriately for it. So that person should seek the advice of their provider. Find out what their provider states is appropriate for them treatment. If they cannot last for at least 5 weeks without treatment, then you need to find out which vaccine, if any, will be better for you. But I'm pretty certain with most immunocompromised people, they are giving them the vaccine if they can give them a window where it would be absorbed.
That's great. Great information. Great. Thank you. Dr. Allen, you have another question. I know you do.
Well, I just want to go back and reiterate again the purpose of us being here tonight. Our purpose is to educate our community, to make sure that they're informed about the decisions that they're making, and that whatever decision they're going to make, that they have an informed decision. You have concern about the side effects of the vaccines. We touched upon that. Minor side effects. You may get arm soreness and things like that. People talk about, and Dr. Horner comment on that about, somebody died after taking the vaccine. We have done thousands of research. We have not found an individual. If somebody out there knows about an individual who directly died from an anaphylactic reaction or something caused by that vaccine, please let us know. But we have done our thorough research, and there has not been any side effects besides nausea, some arm tenderness, and some fevers and chills that went away with the first and the second shot. A second thing, we talked about the vaccine were made too fast. As we talked about before, this has been around a long time.
Come on.
If anybody knows, if you ever go to the hospital, it does not say COVID-19 test. It says SARS. Remember, SARS came around long time ago. So this vaccine was already in the making, and they found out that a piece of this virus was also found in the SARS virus. So it's not something new, that is something has been out there for a long time. Again, we talk about distrust in the government and the community. Again, like Dr. Hawkins said, pick your battle. Sometimes you're not going to you don't like the police department, you don't like things, but they're not coming into your community all the time. We're giving you an opportunity to live.
That's good.
And then we have those people who are anti-vaxxers, so they don't want to get vaccinated. So what's happening now with the school-age children? And Dr. Dixon can speak on this. Now we're getting measles, mumps, and rubella, and all those things have been eradicated before. So people, you got to understand that we are here to educate you. You have to understand and make your own choice. I'm going to be around. I got a vaccine. Someone's going to say 5 years from now, you're going to have a horn. I got a horn, but I'm living. But that's a whole different story. So again, we got to choose our battle. So you got to make sure that.
Dr. Allen, I don't know what I want to do with you.
Right, I'm sorry.
No, you're all right. Listen, our time goes by so fast. We just get started, and it almost seems like it's always time to go. But listen, how can our viewers, if they have comments, questions, how can they follow you or get a hold of you with that Dr. Horn? How can they get our followed? And what would you want to close and remind us that you before you let us know how to get a hold of you?
When it's your turn to get the vaccine, please get the vaccine for not just you, but for your family and your community. You can reach me at Family Christian Health Center in Harvey, Illinois. I'm also on social media on Instagram.
Awesome. Dr. Horn, as always, we thank you for all your amazing insight that you always bring. You'll be back. We'll be back. We'll be back. Yes. Portia Scott, totally agree. Yes, listen to that. Dr. Dixon, parting words, and how can we get a hold of you?
Yes, please get your children vaccinated. Like I said, the vaccines for COVID aren't available for children yet, but the other vaccines are available. So we don't want, like Gwen said, we do not want measles and rubella and chickenpox.
That's right.
Polio. Please get your children vaccinated. And where you can reach me, same as Dr. Horn, Family Christian Health Center in Harvey, Illinois.
Awesome. Listen, Dr. Dixon, thank you so much. You are a wealth of knowledge. We're going to definitely have you back because we're always looking at ways that we need to do what we need to do for our children. I would love to talk about obesity in our children later. Because that is a major problem, that we're having. Baby, you can't give them all in and out and McDonald's and all that. We got to have some green beans, a little salad.
Yes.
With that, Dr. McKinney, we love you, darling. Parting words. But you were preaching tonight, Dr. McKinney. You was preaching. I almost had to pass the offering plate around. Parting words, and how do we stay in touch with you?
Well, I want everyone to know that every person on this show is committed to health and wellness of the Black community and everyone actually that we come in contact with. We take out of our time, we take out of our life to make sure that people are educated about information, and we have to make an informed decision. So vaccines, everyone has an opinion, make sure you look at reputable sites before you decide you're not going to do anything, and have a discussion with your provider about all your feelings. QAnon is not a reputable source. So try to, look at it from a different perspective. There are studies out there. If you want to read them, your provider will give them to you. So I'd rather you die fighting than die in silence and suffering.
That's
so you
right.
can reach me at Lake Charles Memorial Hospital for Women in Lake Charles, Louisiana. And we'd be happy to see you. And I'm on all social media. I'm on Facebook, Instagram. So yes, we're out there.
Awesome. Again, this was such a wealth of knowledge. Dr. Allen, my co-host, Dr. Allen. Yes. How do we get parting words, and how do we get a hold of you at the Gardena Women's Center?
But first, before I go to that, I think we need to tell people how to find the vaccines in your community. Go to your website. You can go on the website for your government. County. You can go to county, whatever county you look in. You can go to CVS. You can go to Walgreens. A lot of the conspiracy is that, there are not enough vaccines out there. You can go outside your county. You can also go to myturn.gov. myturn.gov. You go in there and you can put in your name, the time frame, and things of that nature, and then they will tell you and send you an email, the time frame, and where you can go and get a vaccine. So it's very important for you to go on the website. There are vaccines out there for you. Again, I know I can talk forever, but get vaccinated. What you got to understand, again, like Dr. Horn and everyone stated, you have to get vaccine. The Pfizer and Moderna, the one came out earlier. We may not have them available. The Johnson & Johnson is the one which is available right now. And so what you're saying that, it's not as, efficacious, or it's not as good as the other two, but it's better than nothing. And so again, I say this to all my colleagues, and I say this to all people of color. We're always on that late train, people. So if you were on the first boat, you would have got the one that was more efficacious. But at this point, we're on that late train. It's better than nothing, but it will stop you from being hospitalized, and it will stop you from dying. And that's our goal tonight, so we can have Black America live longer.
That's right. I love that. As always, we cannot thank you enough for joining us on this Mental Health Matters with Marty show as we continue the conversation with House Calls with Dr. Allen. Stay tuned. We will be back in 2 weeks with another exciting panel. We're almost going to have house calls with all these amazing ladies because they're amazing, and we cannot appreciate you guys enough. Listen, make sure. I love that. myturn.gov. When it's your turn, we urge you, please, please, please get the vaccination. Do whatever you have to do with that. Again, my name is Martina Sellers. I am your mental health hygienist here on the Mental Health Matters with Marty show. Please check out our podcast. We just dropped the part 2. If you did not listen to it, please listen to part 2 of Black Fathers and the role of Black fathers. Again, you can subscribe to my podcast at any of your favorite venue for listening to podcasts. If you are an Apple listener, please give us a 5-star rating and a wonderful review to encourage others. And become an I Matter with Mental Health Matters with Marty by simply texting I Matter to 855-717-1272. Again, 855-717-1272. Again, we don't want you to suffer in silence in the shadow of shame. That, as we always say every week, we want you to speak up, speak out, and live. But more importantly, enjoy your life. See you next week. Enjoy your life.